Hey guys, welcome back to another episode of the Everyday Educate podcast. I am joined today with Grisette. Am I pronouncing your name right?
Yes, you did.
Okay, cool, awesome. Um, well, it's a pleasure connecting and talking to you. Maybe you can let us know just a little bit about yourself, your background, what you do, and then we can jump right in.
Thank you. Likewise. Thank you for having me today. Yes, so a little bit about myself is let's see. Well, I've been in actually both worlds, in the clinical world as well as the educational world. So I was a therapist, which we now refer to as RBTs, which stands for Registered Behavior Technicians. And what it is a certification that is provided to any individuals who are looking for employment that just even have a high school diploma. It's available to you guys. You guys just need to log on to the BACB website. That's www.bacb.com. And it really walks you through the process, but there's a lot of modules of training and you take the exam. So, anyway, I went a little bit off tangent, but I did a little bit of that for 5 years. Was enrolled in a scholarship program for masters to complete an early childhood special education credential in the state of California. So I completed that. So I was teaching in the process, so taught for 5 years in rural communities as well as California distinguished schools such as Orange County, as well as San Diego, with really good schools, inclusive settings. And I returned to the community, which is my passion as well. As much as I love the classrooms, my passion is working with families and building the community. So I am now a BCBA, which stands for Board Certified Behavior Analyst. Again, more information on bacb.com as far as that. But yeah, that's pretty much where we stand right now. And I worked for a couple of companies and I had a mission and a vision, and I've embarked on that, and it's where I'm at right now.
Awesome. Well, I want to um, kind of pull on that mission and vision a little later, but maybe walk us through behavior analysis. Um, what is that? How is it different from special education teaching? Um, what's kind of the all-encompassing? What goes under behavioral analysis?
Great question, and very valid as well, because there is a lot going out there and it can really be overwhelming and bombard parents. And as someone who wants to give the best to your child, it's good to know what resources you have out there. And what sets us apart from all of the rest is that we're science based. We are research based, so we are supported by evidence based practices. So the health insurance companies support us as well. So we have our national provider identification numbers, which, it's kind of like your doctors. We're in network providers with multiple health insurance companies. So basically, it means you shouldn't be out of pocket to help your child, especially with early intensive intervention. So, that being said, we are contacted, we receive referrals, or they come to us and we conduct a whole assessment process, which is the functional behavior assessment. What I do is determine the why of the behavior. So if your child is having a tantrum, or, well, oh, he's, feeling a little bit of this, well, that's subjective. We don't really know what he's feeling if he's not able to communicate. But what we do is we observe. So everything's observable and measurable. And we make definitions of this and we target behavior. So we literally make goals of so and so's behavior will be reduced to 0 times or maybe 1 time a month, and such. And so we develop programs certain hours a week with an RBT, a therapist, which is what I used to do. Now I supervise, and I'm a supervisor and also owner. And so the idea is we work together to develop and implement these plans. And throughout the process, every session our therapist goes, documents, tracks data. We now have, back in my day, we used to use these big binders and actually graph this graphs ourselves. You see the graphs going or decreasing. And now it's on the iPads, or tablets. So it's nice. We get to monitor progress
Mhm.
and get to show parents. And every 6 months, we show insurance companies, is it being effective or is it not? And if not, what happened? Well, there were cancellations due to COVID. These are the amounts of cancellations or such. And we continue to receive more funding to continue, or maybe we need to reduce hours or such.
Got it. Yeah, I was speaking with someone else that was in a speech therapist. I believe NLP was the title. I forgot what that stands for, but she was also saying how um OTs and now is the official title behavior analyst? Is that the accreditation that people go for?
I guess it would be BCBA,
Yeah,
because we're board certified.
got it.
Mhm. Yes,
And
good question.
so does the BCBA, that analyst, do they do the observation and measurement, that FBA, that assessment that you mentioned? Are they the ones that are administering and going through that? Or is there another doctor or their primary that kind of gets involved there?
Great question. So it originally would begin with, you're right, with either a medical practitioner or that would refer the patient
Got it.
to seek further, I guess, more clarification on the matter. So they would conduct their own assessments, and that would come from a psychologist or a psychiatrist, but psychologist is enough. And so they would provide a medical diagnosis. So I can't speak for every state, but California is very rigorous with who they allow in their special education system. As far as teachers go, you have to have at least units going on, like there's a plan. And so that being said, there is a medical diagnosis that goes in place, and there is an educational diagnosis.
Hmm.
So the IEP and the individualized education plan is something that there's a school psychologist, a school speech pathologist. Sometimes nowadays, because research is showing, there's BCBAs that work for school districts as well. And they all work together with the parent, with the child, and they develop their own goals and special education system for the schools. And so there is a diagnosis there. And those are their range around the different diagnoses that they might be. And then there's the medical field. So sometimes we do see often, I mean, me as a teacher, I wrote many IEPs back in the day, and we would see sometimes the medical diagnosis maybe saying autism spectrum disorder, but the educational maybe said speech delay or orthopedic impairment. There's different factors, but in a nutshell, yes, the doctors will refer first in our field, in the ABA field.
Got it. Yeah, that's a helpful distinction. Thank you for that. So kind of the BCBA OTs would fall under medical, obviously their primary psychologist, and then the special education teacher um, would go more in the education field. So it's kind of, they're splitting. Obviously on the education side, like you mentioned, there might be a speech therapist on staff and what have you. They might be employed by the school.
Correct.
Awesome. That's really helpful, even for me, because I'm not in the field. We're kind of behind the scenes, but it's helpful to see those distinctions, and even for people that might not know, um, to know how those arise. Um,
Definitely.
I do see you guys have some values on the site under the acronym of ACTS. I would love to go through that because I think it's so on point. Um, could you walk us through your guys' approach when it comes to ACTS?
Yes, definitely. So, what goodness, I haven't even brushed up on that lately so far. It's been a little bit of a while. That would be more of our theoretical. So that's kind of what drives us at the end of the day. That's seeing the big picture, encompassing it all together, and ultimately individualizing every factor out there. So, yeah, it would be just the main picture of starting everything, getting everything started, not leaving any child behind, and individualizing to every family needs, and yeah, really pushing it.
Got it. I under the treatment fidelity, could you elaborate more on that? Like, is that just the care of treatment that you guys are providing, and can you maybe just elaborate on how you guys handle that or go through that?
Definitely. Well, we handle it as best as we can, given that there is a lot of change in things that happen with treatments. And there is research shows that there's a lot of high employee turnover rates. And so we do the best we can with that in peace. But what treatment fidelity means is that we're following up with all those goals. We're collecting data, and we're really managing our treatment plan. So like I was saying earlier, like we're really focused on individualization. So let's break down the big mission vision and now just bring it down to this client. And it does not look like it does next door. Every client, every child is different. And that's why in California, there are many laws and that are encompassed with even special education. I was very fortunate to have it in the education system as well, because they're really encompassing No Child Left Behind and really pushing it there. So with the fidelity, it brings us to that, to make sure that we are doing our best and keeping track of those data, progress monitoring. If something's not working, let's change it. Let's also get everybody on board, because the treatment plans include families, because we're not miracle workers. We can try, and we definitely go to sleep every night and wake up to make a change in this world. However, we can't do it the 3 hours we're there, even if we are there 5 times a week. If it doesn't get carried on after the moment that we leave and onto the weekend, we don't expect to see very fast results. But if parents are on board, and everybody in general, that's why we also collaborate with speech therapists and occupational therapists, is because if we are all on the same page, then we can really see the change much faster.
Yeah, that's such a good point. And as much as the teachers that we're in touch with, and educators and district heads, and even the higher ups, as much as we're investing into this, it is hard because we're not with the children 24 hours. So how much of what you guys, from the data that you guys see, and I love how you're mentioning data and science, because everything has to come from there. How much of that gets transferred to the parents, or is there weekly meetings and showing them those progresses and educating them on how to better communicate, deal? Maybe walk us through that as well if you can.
Great question. Like I said, everything's individually based. So we, depending on the client, so it's their needs. So we try to offer as much as we can, and we do try to aim for 1 time a week. However, parents are really bombarded with a lot of juggling school, juggling work, juggling all the therapists. There's speech, there's OT, there's ABA, there's, they're trying to put them in a soccer team, and there's just so many things going on. And there are different agencies approach out there, and some really demand and really push for that time. I've seen and I've lived in many years, and I know that it's not good to push parents to the point where you need to push, but to a certain extent where not everybody is on the same page, and you really need to individualize even for them. So that being said, for example, if a client has a huge need with toileting, then we're going to really work together on that. And you're going to need me maybe even 2 times a week or 3 times a week. But I will do that. And I will, when other clients are also not needing myself, if other clients need me, it's about balance. But that being said, the cards flip and the roles switch a little bit as far as who needs the most at the time. When we first start, we're really intensive as well, developing those communication systems, because even though we're not speech therapists, a lot of the function of the behavior and the reason why they're happening is because they're unable to communicate their wants and needs. And so therefore, we need to teach our parents how to run something we call an evidence-based practice functional communication training, FCT, is, teaching parent, when child cries at the cash register, I know it's overwhelming, but you can't give them a chocolate. They need to ask, and they need to quiet down. If you're giving them the chocolate every time they're crying, child is registering, I need to cry, so I get chocolate. And so we really work on those things with them. And to loop back around is it really individualized.
Yeah, it's fascinating you mentioned that, and quite a few other people have mentioned that as well, that one of their main goals, knowing that they've done their job correctly, is, and this was on the mission question of like, what's their purpose, their mission. Her answer was, if I can get the children to communicate, whether that's verbal, written, on an iPad, any way that communicates, her job is done. And she wants to like hone in and focus in on that, which I thought was really fascinating. And you're kind of echoing on that too, um, and obviously again, speech therapists are going to get involved with that. That's their bread and butter. But I guess transitioning into your mission, your purpose. I know you mentioned it in the beginning, but I would love to hear, why are you doing this day in, day out? What's kind of the spark that you've gotten from this?
It might sound cliche, but it pains me to see agony. It pains me to see a mother, a father, a caretaker that wants to help and doesn't know how. And that is what I find the main piece to be. And that's what differentiates me with, other therapists out there, is that we're behavior based. So we need to make sure behavior is socially appropriate based on parental preferences, cultural preferences.
Mhm.
I respect that first and foremost, and age developmentally, what's appropriate. We stick to the science, but with an empathetic side with it, empathetic approach. And so, yeah, that's pretty much what drives myself. Is I don't like to see that pain. I don't like to see that learned helplessness, and in providing those resources and tools. And throughout the years, because I have done this for about 13 years, is or 15 with schooling and such, but is that when you get to see this, you get to the point where you realize that you're doing the best you can, and you have to draw limits for your own self as well, and know that you can do so much, but there's some things you just cannot change. And after that happens, at that point, you need to learn to have your own peace and know that you can't make everybody see things the way you see things. And also, we're also don't know everything. We're always learning everything, and we know our biases. We have to come to terms with things and be able to come neutrally. And yeah, and then to go off of that, for example, I had a client today before I came here, and client had a tantrum, a huge tantrum. And the reason why it happened was because we're barely starting. So there's things I have to explain to mom, to go back to that question, to piggyback on the science used with parents. I had to explain to her today that that's something that is actually called an extinction outburst. And what the extinction outburst is after, when she would cry, mother would come and hug her. She learns to cry and mom hugs. But the moment that we kind of did planned ignoring, so we're always keeping an eye, making sure she's not hurting herself or others, and just that planned ignoring of, we're not going to reinforce that negative behavior because she doesn't know any better yet, or she thinks she does, but we have to teach her the appropriate way. And so, long story short, the tantrum went on to be about 20 minutes. And in between, mom was asking, like, is this okay? I said, yeah, we've had 1 hour tantrums before. And I'm very sorry. And grandmother was there. So it was lovely to have both. And they were both team tagging and tag teaming and everything. And at the end of the 20-minute tantrum, and then I said, and we have a client who had happened with 1 hour, and you can find him on our website. You can see him now. He speaks full sentences because of that 1 hour tantrum. We had a breakthrough. And it may happen in situations, it may not in others. It's a breakthrough and it's individually based, but we need to do our things. And we need to have parents trust us and walk them through the process, give them the tools. I had token board systems. I had a first and then protocol. I had everything set up with positive reinforcement all around. Parents had choices. They had the items of food that she had available. We had a set schedule and they were on board. After the 20-minute tantrum, she started talking already. She started saying words, and mom's face and grandma's face with, oh, did you hear her? Did you see that? And then, and I'm like, this is good. Now you can hug her. Now give her all the attention. Give her high fives. Give her kisses. Give her everything, because now she's sitting down. Now she ate yogurt, the 5 bites of yogurt, instead of the lollipop she cried for because she hadn't had anything else. So those kinds of things are things that people just turn quickly and say, oh my gosh, the child is crying. And they have no idea what is going on, what plan is taking place that is going to change that drastically. And that's why I like doing what I do, because parents, families, communities, that's the change, one at a time.
Yeah, I love that. And thank you for sharing. I was actually you kind of read my mind because I was gonna ask for an example of something like that. But that the tantrum into, I guess, peace and I don't know what the word is officially, but just the calmness is really helpful to kind of envision. But would you say what do you guys see as like I know it's very individualized and each child might have a different behavioral thing to work on, and even as adults we have behaviors to fix and work on. But is there a theme that you guys see that these are the main behaviors that we have to constantly deal with? Is there a high ranking behavior that you guys deal with?
Great question. I would say we do see the trend of having like mainly non-compliance and tantrum. There are occasionally and
Compliance.
uh-huh.
What
So, oh, sorry, continue.
I was just saying, what is non-compliance?
So, and that's the science, right? So that's a topographical definition would be, and I'm giving an example out there, it would be dropping to the ground,
Mm,
waving hands, kicking, may or may not say no, 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 whining,
mm,
walking away, ignoring,
mm.
changing the subject. Uh, that's an example, right? And then sometimes you might add may or may not involve throwing items. Um, so that would be because our idea is because scientifically is I'm given a definition and I'm going as a therapist because I might know these things because I'm a supervisor. I have my master's. I went to heavy schooling and my RBT when I was that, we don't know that. You're starting afresh. And so what I need to know, because I don't have the level of qualifications you do, is I need to have a verbal definition here that explains to me, oh, little Billy is, oh, dropping to the ground, ignoring me. Oh, this is a non-compliance check. There's one for today already.
Mm.
And so what that happens is when we give a task directive, an SD, which is we say, come here, and 1, 2, 3, we count for 5. If it's a non-response, that's a no. So on our data, on our tablets, our iPads, we put no. So no, it didn't happen. And then when they do respond within the 5 seconds, then we say yes.
Got it. Makes sense. Okay, that's really helpful.
Yeah.
I want to move to maybe students that are, let's say, first grade to middle school, like kind of entering into high school. What would you say is the 3 to 5 most important skills, things they need to develop in order to be successful in high school and post high school? Maybe like foundational things. I know previously someone's mentioned like they just needed one, that communication. If I'm able to get them to communicate, my job is done. I think they'll be successful. This is a skill they'll need in order to be successful in their real life. What are what are your foundational things that they need to have in order to be successful?
I would have to say, and tie it back into our mission and our statement is ability and strength for life. So that kind of guides everything. So anything from social, I would have to say social skills, which someone might say that's kind of communication, but it's not. There's so much nonverbal language that we are not aware. Being independent, but with the definition that independent means doing things correctly. Uh, for example, if we teach someone and we say, oh, well, that's okay because he's doing it by himself, but they're doing it halfway, then it's not really independently yet. So, really emphasizing, let's really build on that and maybe address that it's not independent yet until it's 100% or 80% mastery, So they leave a little bit of wiggle room to make mistakes. We're all human, but aim it as much as possible. And you said 3 to 5, so that's independent social skills. Let's see. I would have to say there's many strategies that we use with ABA, which are, for example, like teaching vocational skills. So that's huge for that population, and adaptive skills. Those are the two areas we would have to go into. Depending on insurance companies, I just want to throw it out there. Some do not provide funding for us to work on those. Private pay, of course, but insurance funded, we do not. So we really have to be careful. But they do allow me as a BCBA, our level, to work with parents to make that happen and drive it out of them. We're very fortunate here that we have regional centers. So this is very helpful for our families. They're able to reach out to their service coordinators, and they provide trainings and modules and a lot of information out there, constantly webinars, so parents can become informed and go there. But yes, self-help skills as well. I think that age developmentally, we really need to really close those gaps, your developmental level, but also your age socially, how you should be. Now, depending cognitively, some kids may or may not advance as progressively faster than others, and that's okay. I think, and then the most important thing is overall mood, just be happy. I think the main thing that I've taken away from every setting I've worked in, and in every socioeconomic class, everybody wants to be happy, wants their child to be happy. Parents want to feel a little bit of satisfaction, that they did something.
Yeah, I love that. And thank you for breaking all those down. I think the priority, if you were to summarize it, even in social skills and independence, I think that even suffices. Like, I'm sure you would say, okay, they got these two down, and even those are kind of, they have an interplay. So I might be independent, but I still need mom, dad, friend, brother, sister, boss, coworker for something. So that social skill plus independence, there's going to be a play there, but knowing how to ask, when to ask, if to ask, like all those that we struggle with, I struggle with day to day. Even those can be important. But then you mentioned mood, vocational skills, adaptive. There's a lot. So I commend you guys and thank you for all the job that you guys are doing, and hopefully more people can tune in, listen, learn from you guys, and benefit from the services. How can people connect with you as we wrap up? I know we're both in California, we're neighbors here, but how can people connect if they have questions for you? Just want to connect and see what you guys do, what services you offer, and just overall how you can help. What's the best way to get in touch with you?
Definitely. Well, I would say any way that they feel comfortable with. We have all the information on our website, and we do have an Instagram account. We have Twitter. We have, let's see, our phone number on there. So if you guys can give us a call, email, or any of the platforms, send us a message, and definitely we'll be sure to reach out and try to see and start working with, if you have any insurance companies or you want to go the private pay route, however best convenient.
Awesome. Well, I'll definitely link all of those social handles and the website in the description below. So if you guys found some value out of that, please feel free to check those out and get in touch with Rasad. Thank you so much for jumping on. I hope we can do this again. Yeah, if there's anything that we can provide on the sensory toys front, fidget toys, let's stay in touch. I'm glad
Definitely.
to donate whatever you guys need for the kids. So we'll definitely stay in touch.
Yeah, absolutely. Thank you guys. And anything we can help with, as well as, any reinforcement systems, you guys are having issues with a little kid being motivated enough to start working, let us know.
Awesome. Absolutely. All right. Thank you so much.
Yeah, you're welcome. It was a great pleasure meeting you face to face.
Awesome. Thanks. Bye.
Bye.